Okay, thank you so much for joining us on this Thursday evening. We are so excited to welcome all of your students back to school in a few weeks. We're rounding the bend towards the end of summer, so thank you so much. A little bit of housekeeping business. This is a webinar and it is being recorded so that we can share it out with the community tomorrow. We do have a slide deck that we will be presenting from. The slide deck and a link to all of our resources will also be in a COVID themed email tomorrow, as well as a few call to actions that we will talk about as we go through the slide deck for our parents to take. And please use the Q&A and or chat function for any questions that you may have. There may be some questions that you ask that we will say we don't know, and we will find the answers and get back to you, but we're trying to provide you with as much information as possible. This webinar is really focused, and this town hall, on our COVID procedures for school. So questions about anything and everything pertaining to hot lunch and snack and your student schedule and all of those, we ask you to hold those questions. We will have all of our orientation and emails and information coming out, but this is really a COVID focused webinar. For new families, welcome. We have a lot of new families joining us this year. For families from last year, you'll see a lot of familiar information in this webinar tonight, but you'll also see a lot of modifications. It is a different year. There's pros and cons that we will talk about based on where we are at. So I'm going to jump in and share my screen. All right, so welcome. Our goals. Our goals for this year are the same as our goals that were for last year. Number one is health and safety for all, for our students, for our faculty and staff, and for the impact that Seacrest makes on our community, academics and learning, and being mindful of the social emotional wellness of our students and our faculty and staff. We are so beyond lucky that we have a health and wellness committee that helps us, Jackie and I, really disseminate all the information that comes down. So I should have started with the assumption that everyone knows who I am. My name's Lauren. I'm the head of Seacrest School. If you're joining us and you're not part of Seacrest, well, welcome. Jackie is our CFO and also a main critical player in our COVID task force. Our team helps greatly with all of our health and safety measures. We have a health and wellness committee that is comprised of 5 unbelievable parents that have given us their time and talent and hours to take information from all different sources through their work and best practices from the hospitals and medical institutions that they belong to, from the county, from the state, from the CDC, and really help us find the best plan. If you are new, a little bit of our method is to know that it always goes from the most local to outward in our protocols. So while the CDC or the national government may have something, the state government may have something, the San Mateo County may have something, then the next layer down would be San Mateo County schools, and then Half Moon Bay, so very regional. So often what we have found over the past year is that based on where we are geographically, Half Moon Bay will be the most conservative in that laundry list. There's a lot of variance of the rules and regulations across the country, across the state, across different counties. But our job and the governing body of our school is through our County Office of Education in San Mateo County. So when you look online, you may see and read the news, lots of varying things. Know that while we look at all of those, it really starts closest to home. Joining me tonight on this panel, as I mentioned, is Jackie, who is our CFO. We have Roxana and Jessica. You can see their credentials right there. They have been instrumental, and they will be here to offer their perspective and answer all and any of the questions that we can that you may have this evening. Here is a small snapshot of a few key points we wanted to make sure we articulated tonight. This is what we learned, the takeaways from last year. If you remember, Seacrest School was open. We were in the first round of approved waivers from the San Mateo County Office of Ed and the state of California. We welcomed back over 200 students over the course of August through September. It was a rolling, bringing everyone back, and we were able to deliver education on campus option throughout a major portion of the school year. There were a few breaks here and there, but we were on campus a lot. What we learned are that schools are a safe place to learn, connect, and play. It is proven that the risk of transmission is low in schools when safety measures are in place. Last year, we had only 2 student cases that made their way to campus. There were more cases throughout our school community, but there were 2 cases that actually those students were on campus for a full day. Both cases were contracted off campus, and there was 0 transmissions. That is really the goal. And Roxana and Jessica will talk a little bit more about the reality of what we're facing this year with the Delta variant and case numbers and cases within our community. But what we're focused on is not necessarily that there'll never be a COVID case, but that COVID isn't transmitted within our classroom and on our campus. And just a little note that by the spring of 2021, 94% of our students were learning on campus. So it wasn't that we had a small percentage, we had a very large percentage of our student body on campus. Before I jump actually into this, you got a little sneak peek. I am going to stop sharing my screen and just want to pause right here and offer a little snapshot of where we are today. If you're like me, yes, I wear the hat of the head of school and get a lot of information in my inbox about COVID in schools, but I'm also a parent of 2 young kids. They are not eligible for the vaccine, a first grader and a second grader. And I find it often really hard to understand all of the information that's coming to us. What really is safe? Are kids really getting it? Are they getting it that bad? Should my kid be wearing a mask all the time? Where are we seeing case numbers? What is really happening? So before we jump in, I'd really like to ask that Jessica and Roxana give us a little bit of a snapshot of what you're seeing with the Delta variant, with rises in case numbers, and as 2 parents with kids, I should also mention, that are not also eligible for the vaccine. What should we be looking at? What should we be thinking about from a parent perspective?
Jess, do you want to start? You want me to start? Okay. So, well, first, on behalf of many parents, we'd like to thank both Lauren and Jackie for having such strong protocols both last year, and we feel very confident that we're going to be able to continue that for this year, even though the climate of COVID has changed. And I think that many of us are feeling more relaxed, but at the same time, a little bit uncertain because of this Delta variant. And I think one thing that we can take away is that this Delta variant is real. It's not just, a media hype thing. There is a difference in the infectivity of this variant than there was when we first started. And this variant does affect kids differently. That means that kids are more likely to become positive from COVID due to this variant than they were when this whole thing started. Fortunately, they still don't get as sick. That means that even though they turn positive, kiddos still aren't inundating our ICUs, still aren't being intubated in the same way as adults are. So while we all still wish that our children could get vaccinated, we still have faith and we still know that going to school is still safe, as long as we're all adhering to these protocols. But it's real and we have to stay vigilant, and we thank you for having the protocols in place for our kids.
And I'll just hop on from that. Thank you, Roxana, and a double thank you to Lauren and Jackie and everybody that's been involved in all the protocols and then just keeping the kids safe. And I mean, speaking for Roxana and myself, and I know Hannah as well, who's been on our committee calls as doctors, we would not send our kids somewhere that we wouldn't feel safe with them going. So I think that speaks to something as well. The last year went, I think, about as well as it possibly could have. Lots of changing gears, lots of, oh, wait, this just changed yesterday. Let's pivot. I think pivot became one of the favorite words of 2020 and the beginning of 2021 for good reason. And kudos to you, Lauren, and everybody for being able to keep up with that and then constantly asking, what does this data mean? Because none of us know everything. COVID is an enigma that keeps changing, like many viruses, all viruses, and we've adapted significantly, but we're learning every day too. We don't know all the answers. We're learning more, and whenever we are finding things out that are new, the goal is to really just continue to adapt to make sure that everybody's being safe. And for us as parents, and then for teachers and staff at the school, our job is to make that environment for our children, for the kids at school, the safest it can be, which means get vaccinated if you're eligible, keep doing the masking like there's mandate for, keep being safe in terms of your outside of school exposures, because like Lauren said, we know that this is most likely not going to be something that the kids are passing around to each other in school, but we are going to see some positive cases because, as Roxana said, there's increased infectivity. Just look forward to the fact that kids are going to be positive probably more this year in school, but they're probably not going to pass it around to each other in school. And so one of those key tenets too is if your kid has any symptoms, keep them home. If it's a sniffle and you don't know what it is, keep them home. Because what we don't want to do, since it is so contagious, we don't want to take that chance. Both from being a doctor and a mom, I think it's one of those really hard things, right? Where you're like, my kid's sniffling. What do I do about this one? Keep them home is the right answer, which is always really hard as a working parent, right? But that's the right thing to do. And I think just knowing that, we're looking at different things like the screening protocols, which I know Lauren's going to talk about in the slide presentation, but continuing to adapt this and, the frequency based on what the case rates are locally. And again, just hoping everybody can be patient and work through everything as we all work through it.
If you want like current numbers, in terms of the pediatric population, the numbers are still overall incredibly low compared to adults, in that less than 5 groups. So our TK group, our junior kindergartens and our kindergartner groups, there's in all of California, there's been less than 100,000 cases. In that wider group, that 5 to 17, there's been about 500 cases of pediatric positive cases. And in that 500, there's been 23 deaths, and the majority of that has been immunocompromised kids. So, I mean, even though the numbers are starting to rise, it's like these kiddos are still doing remarkably well with mild symptoms.
Thank you both so much. And if there's more specific questions that you may have for Roxana and Jessica, please put them in the chat or in the Q&A, because we will have time at the end. When I start going through the slides, so Seacrest School is committed to being as agile as we were in the past. Best laid plans is what we learned. Jessica mentioned the word pivot. It would be lovely to say that exactly what I present tonight and every information that you read and all of our calendar events are going to stay exactly the same. But the reality is, as was mentioned by both Jessica and Roxana, it's a moving target, and we always will put the health and safety above all. So as much as I'd like to say this is ultimately what it will be, the reality is there will probably be moments of pivoting again this year, of being agile, of communication, of altering. When we talked about opening the school year, we wanted to really find the balance of honoring new families, welcoming them in, the students, but also being really conservative on our health and wellness practices. So, you know, I really appreciate that the Health and Wellness Committee major recommendation was to start the year as conservative as possible, learn from our testing strategies of what is happening within our Seacrest school community, and monitor what's happening in our greater Half Moon Bay community, and then loosen up. So that's not to say that I have any crystal ball to say when some of these protocols may loosen up, but we are going to start more conservative, regular testing. The Health and Wellness Committee already has pre-planned dates when we'll be starting to look at the testing information that will collect from the Seacrest student population to be able to determine if we want to alter or loosen any of our protocols. We have nothing to lose by starting more conservative, but starting looser and having more cases and more exposure is not a way we want to start the school year. So that is the method behind some of these things that you will see in the slides. So with that, I will jump in and share my screen. As we start talking, there we go. As we start talking about our COVID protocols, there are 4 key principles that are really guiding a lot of how we operate our day-to-day. Number 1 is wearing a mask. Students will be wearing a mask, and we'll go into detail for a large portion of the day. I know that various schools have various of their own protocols of how they're approaching this. This is Seacrest ways of starting the most conservative, looking at case numbers and trends within our own student population, and then adapting to that. So students will be wearing masks during recess. They will be wearing masks during athletic and PE classes. As we get a few weeks in, if we see decreasing case numbers and we do not see a spike within the local population, the Health and Wellness Committee will meet and discuss, is there a modification we'd like to make? As Jessica mentioned, staying home when sick. Seacrest families were phenomenal at taking that sacrifice. My kid doesn't feel good. They have a stomach ache. They have a little runny nose. We'd get an email. We'd get a call. We'd get a text. They'd pull up and not open the window and say, they're not well. Should I take them home? And it really helped us last year have 0 transmissions. It's hard, especially for those little guys. If they have any postnasal drip and they're wearing a mask, it's not really functional at school. And we don't want our teachers to be in that situation. Hand washing and hygiene is still a top priority. Our hand washing station, our hand sanitizer, all of those protocols are still going to be woven into every operation of the day. When kids arrive, they wash their hands in and out of all of their transitions, especially around eating and snack and things like that. And then really proper ventilation. Seacrest School is so lucky that all of our classrooms have great ventilation. We have lots of windows, lots of airflow, fans. We have CO2 monitors and air purifiers in every single space. And having those spaces open and functioning as much as possible is going to be our goal. As I mentioned, students will wear a face mask while they're at school, except during designated times. As we start the year, that will just be eating. The school will have face coverings available for students whose face coverings become lost or damaged. I really recommend, probably at this point in the pandemic, we all have this, but find the mask that properly fits your child. Find the mask that they like, that doesn't irritate them or stays on their ears. Please put an extra in their bag. While yes, we have lots of PPE and lots of disposable masks in children and adult sizes, that, depending on the child, is, if they are used to something else, can be really the thing that makes them not able to concentrate in school the rest of the day. A proper fitting mask is the same as a proper fitting shoe. Find what works. Have a backup, send it to school with your child. That only helps your child not focus on it during the day because they're used to it. It's comfortable. And if you need more information, we have proper a link right here. Face masks should be washed every day, all the time. So please follow those protocols as well. Students will generally remain in their department cohort. So this is different than last year. They no longer will be just in their classroom cohorts, but they will be in their department cohorts. The department is JK through first, second through fourth, and fifth through 8. Depending on which department you're in, there may be more departmental mixing versus less. When we talk about this, we're really talking about recess. They will be masked. When they're eating, they will be with their specific class cohort. So we will be able to contact trace. There are, especially if you're a parent of an upper school student, there are real learning advantages to mixed cohorts when we level for classes like math and things like that. So we have taken that into consideration. We will be able to contact trace who your child has interacted with. So know that it's a little bit more complicated than them being in just this group, but we are still having a watchful eye of which students interact with which students. Snack and lunch will take place outdoors with distancing enforced. Really important, especially for parents with young children. Make sure all of the lunch containers are things that they can open on their own. We're really trying to limit the amount of our lunch supervisors and teachers interacting with food containers, water bottles, things like that. For your upper school kids, it's not a bad idea to put a little packet of Clorox wipes in their backpack. They wipe down those water bottles if they're leaving them in their locker or all around. Really think about food and things that go in your child's mouth and the precautions that you can take and the protocols and routines you can practice over this next week with your own kids. That is something that as a whole school, we can't take 250 plus kids and make sure every water bottle never touches anything else. So really try to talk to your own child about that. Note that all the personal belongings are kept outside the classroom along the windowsills. There are hooks and windows and are open and air purifiers are in all the classrooms are on to prevent good ventilation. So sad to present this slide, but the reality that we're in right now, that in California, we have not only COVID, but we also have wildfire season. We all should take a moment to think about our northern neighbors right now that already are facing devastating wildfires. We do have a plan in place for poor air quality. Should the air quality index exceed 100, classroom windows and exterior doors will remain closed and air purifiers will be on and continued running. If in the morning at 7 a.m. the air AQI starts to reach over 130 and it's predicted based on matrices looking at the wind and trends to hit over 150, we will announce via Be Highly a school closure for very unhealthy air. Our goal is not to close school. It's not something we want to do. But as I said, we have to keep health and wellness safe. We do not want to operate school for long periods of time with everything shut down, especially with eating inside with no ventilation. And yet we cannot have kids sitting outside in poor air quality. We'll monitor the situation. Normally you can kind of start to see the trends and we'll know if we're headed in that direction, and there'll be ample communication as much as we can if and when that happens. Jackie's now going to talk to us a little bit about our robust testing strategy.
Good evening, everyone. I know this slide is a bit of an eye chart, but I'm just going to kind of walk you through what our testing strategy is. It says September 2021 because this could change, and hopefully we'll be able to ease up on some of our testing protocols as the year progresses. But the way that we're starting out is in the blue column, you can see we're going to be doing post-break testing. This is our plan. So coming out of summer, out of Thanksgiving, winter break, President's Week, etc., we're going to do individual PCR testing for all students and staff, regardless of vaccination status. That gives us a good baseline to make sure that everyone coming into our community is safe and ready to go. We're also going to be doing a lot of regular screening testing, particularly at the beginning of the year. And screening testing is done on asymptomatic people, and it's done on a cadence that's a kind of a regular basis. We are going to test our unvaccinated staff weekly. The vast majority of our staff is vaccinated, but for those who are not, we are going to be doing individual tests weekly. We are also going to be doing what's called a PCR lab pooled test. And Color is the provider that we use for the individual tests. Color is going to be coming out with pooled tests. They don't have it yet, so we're defaulting to the provider that we used last year, which was Concentric. And what happens if you're not familiar with pooled testing is we take COVID test samples for all the students in a classroom, and we put it into one vial. And the vial can have up to 25 samples in one vial, and we test that. We send it to the lab. If there's a positive test, then we need to do a confirmatory individual PCR test to understand who in that population is positive. And we did the program last year. It worked really well. It takes, the first couple of weeks, it takes the kids a little bit to get used to it, but we were able to kind of do half of our school every week in about an hour. So we will be continuing that this year. We are also going to throw the vaccinated staff in with their pooled test. So those vaccinated staff will get tested as well, along with their classes. Then the third column going across, or third row, I guess, is rapid testing. So this year, something that is going to be a new development for us is rapid testing. We're in the process of getting it set up now. There are two different types of rapid tests. One is the Binax Now, which is an antigen test. And then there's this other molecular, which they call PCR-like, which is a Q test. Unfortunately, the Q tests are out of supply right now, so we're not able to move forward with that program. So instead, we're going to start with the Binax Now test. We're going to be giving our unvaccinated staff daily the rapid tests, just to make sure that they're safe for the classroom. And then should any of those turn out positive, we would follow up with a confirmatory test. Binax Now uses Primary Health for their PCR testing. So any positives that come out of that will be tested through Primary Health. Then we also have diagnostic testing. So as we know from last year, and kind of as we talked about a little bit earlier, kids get sick, and sometimes people have sniffles or they have a stomach ache, and we need to be able to test those kids and understand what's going on with them, if they're at risk or not. And so we will be using rapid testing for that purpose as well. And again, if we're testing people that are symptomatic or they've had a close contact exposure, if we're using the antigen test, which is all we have at our disposal at the beginning of the year, we will need to do a confirmatory PCR test, whether it's positive or negative. So right now we're going to be doing the pooled testing weekly. Eventually that's going to ease up as the case numbers decrease in our county. But for right now, we're going to test students weekly, and it's going to be really interesting to see how the beginning of the year goes. We're going to have a few weeks under our belt, and then we're going to re-meet with the Health and Wellness Committee and talk about our testing strategy to see if we need to make any changes. So I think that's it on our testing strategy. We are going to be, as Lauren mentioned, we are going to be sending out an email tomorrow. And for the parents of junior kindergarten and kindergarten families, you already did the color testing this week on Monday. We're going to do the same thing next Friday for all students. We'll send you an email. You've two things to do. One is to sign up on the Sign Up Genius link, and that reserves your time spot. And the second thing is to click on the color website and register your child in the system so that we can assign a test to them. If you just registered your child for JK or K, you don't need to re-register them. They're already in the system. If your student tested last year, they're going to still be in the system. They may still be in the system. They only last for 6 months. So it's possible your student's not in there. So if you did not already do JK or K, I would recommend everyone just register your child one more time. We're also going to be sending a link for the concentric consent form. So that's the pooled testing. And so we ask that you also go in there. Even if you did it last year, we're asking you to re-go in and sign that consent for this year to do pooled testing. And if at any time you have any questions, feel free to reach out to me on this. I know it's kind of complicated, and we'll all get there. I see that there's a chat. Let me see if there's a question. Can you please explain why the school is not requiring vaccination for all staff members? I don't know, Lauren, if you want to take that one.
Yeah, let's go through the questions at the end.
Okay, sounds good. Okay, so these two slides
are just the breakout.
Okay. These slides just kind of describe the testing in a little more detail. So I'm not sure that we need to go into it right now because we just talked about our testing strategy. We'll send this deck out tomorrow as well. So if you want to read more about it, I just explained what the pooled testing was. So you can move on to the next slide. And this is we already covered. Okay, so quarantine. So what does happen if we end up having a COVID positive child at school? All of this guidance, by the way, comes from the County of San Mateo. So this is not something that we've made up. This is the recommended protocols from the county. So if we have unvaccinated students, so obviously all of our younger students, and if they're symptomatic, that's where we give them a PCR test to determine whether or not they're COVID positive. If they're COVID positive, the quarantine is 10 days from the symptom onset or from the test date. If they're not symptomatic, but in this case they are, then they can come back to school. If they're not positive, but they had a symptom, then they need to quarantine for 14 days. And again, this is just students that have been exposed. And so, because it's possible that it didn't show up in the test and we don't want them infecting other students on campus. If they're asymptomatic and both students are masked, which in our environment, they will be masked all of the time, except for when they're eating, then they have what's called a modified quarantine. So we will test those kids 2 times a week for 10 days. They'll continue wearing a mask, and they are required to not participate in extracurricular activities. So if your student is asymptomatic, but they were exposed to someone at school, everyone's masked. They are not supposed to participate in soccer practice or baseball practice or whatever it is until their 10-day modified quarantine is up. And then if either one is not masked, so this would just be the kids that maybe your student is eating lunch next to, then they would quarantine for 10 days or 7 days with a negative COVID test. And then you just continue to monitor symptoms. So that's for unvaccinated. For vaccinated students, if they're symptomatic, again, we give them a COVID test. If they're positive, same quarantine requirements, they need to stay away for 10 days. If they're negative, and they can come to school as long as they feel well. So there is no modified quarantine or anything happening if you're negative and you're vaccinated. If you're asymptomatic, then same thing. There's no quarantine. We can COVID test, and we probably will, but we're not required to. So if they've been exposed and they are not symptomatic and they're vaccinated, there's no quarantine happening. All right. So the way that it's going to work, last year we did temperature checks and whatnot at the curb. We're not doing that this year. So we've got a 3-question health screening that's going to be driven from our Beehively system. So you'll get a notification every morning at 7 a.m. that says complete your health screening. There's 3 questions you'll answer, you'll submit it, and you're good to go. All students must be wearing a mask when they get to school. So when they get out of the car, they must be wearing a mask. That's really important. And then, as everyone mentioned before, I know Jessica touched on, do not bring your children to school if they're experiencing symptoms. If you bring them to school, they will go home. Like, we sent a lot of kids home last year that were not feeling well during the day, and it's totally fine, but they can't come if they're not feeling well and they have any of these symptoms. I think that's it. Oh, attendance, one more. So if you have, and this is like a general school thing, but if your student is not going to be at school, make sure that you let attendance@seacrestschool.org know as soon as you know. You can always leave a voicemail with the phone number there. And you can always let them know if your student's going to be late or going to be leaving campus early. Just make sure that you keep them in touch. We do have an attendance form and there's a link to it, and we'll provide that in the email tomorrow. This kind of has a couple questions that's trying to get at why is your student not at school. If anyone is sick, we will call you and try to uncover what the symptoms are, and we might even recommend that they come to campus to test. So it's really important that you're very forthcoming with information. We keep all the information about your children's health extremely confidential. It's a very small team of people that are made aware of any sort of COVID exposures or COVID symptoms. There will be students coming and going for different reasons. And everyone, I know last year, everyone did a great job of just keeping everything confidential, and people don't ask because they know we're not going to tell them. So please be forthcoming with that information. If any students are sick or if they're out sick, but they don't have COVID, so they broke their leg or something, let's say, or they're on a family vacation, it's just going to be like any other absence during a normal school year. So they're going to miss class and they'll receive assignments from their teacher. Yeah, I think that's it.
Thank you, Jackie. So a little bit on travel. Currently, there are no guidelines that do not include travel restrictions. So what the really recommendation is just as if you would check the weather when you're going to fly somewhere. Let's say, for example, Florida. If you're going to fly to Florida and you were going to check the weather to see what to pack, we recommend you check the case numbers of the area that you're going and be really forthright with the school. If you're going into a really high area, that when you come back, we can test you, we can maybe do a modified quarantine, something like that. If the student travels outside of the state, we will do a rapid test before they return to their classroom the morning that they return. We do not need to know every time you go to Tahoe or you go over the hill to a Target that may be out of this county. Thank you so much for all of that information last year. It was wonderful, but really we're only looking for larger travel or travel into an area with higher infection rates. This may be something that changes over the course of the year, but this is the guidelines as of right now. Family vaccination status. The school is going to request proof of vaccination for all students 12 and older. If vaccination proof is not received, the student will be treated as an unvaccinated for relevant COVID protocols. As you can see, there are very different guidelines when it comes to exposure and quarantine based on vaccination and not vaccination status. The county has made this a requirement, so we must submit the case numbers of, the numbers of students that have been vaccinated over the age of 12 and up to our county. And if you decline to offer, like I said, we will consider your child unvaccinated. This is confidential information that will not be shared among students or teachers. Parent volunteers must submit evidence of vaccination or a negative COVID test prior to volunteering. There's going to be more details to come. This is one of those things we're going to start very conservative without really many parent volunteers on campus. There will be some exceptions. So if you see maybe a parent coming in, please note that they have been vetted, that it may be more of a critical situation based on their own personal family situation. So we're going to keep all of that judgment to ourselves and know that if for some reason you want to enter the school and we say we're not really having every parent in right now and you see a parent come in, it may be that there's a really personal critical case that they're dealing with. Vaccination status information, like I said, and Jackie mentioned, is extremely confidential and will only be seen by our COVID-19 team. What can you do? Really, the best thing you can do as we get ready to come back to school is have an open dialogue and talk with your children. Share with them that, yes, you're going to be wearing masks, but we're really excited. And I can tell you it's a shared excitement around the school. We're so excited to welcome your children back. Remind them, though, that COVID's still a real thing. They need to listen to their teachers, listen to the adults, wear their masks. For younger children, practice them being able to put their own mask on, taking it off, express the importance of really good hygiene, practice that hand washing with the monster claw and all of that good stuff at home. Get them ready to go, just like you would for all of those other things. Just add these COVID protocols into your routine as we start to get ready. Keep your child home with even the smallest symptom. It's a bummer to miss the first day of school. We don't want COVID cases. So those days where you feel like, oh, I don't want them to miss, know that this is a very small moment in our time, and the greater picture is the health and wellness for all. And really model at home. I know that summer became a lot more free, and it's very hard to kind of rein things back in as we're seeing Delta come up. Kids listen, but really it's they watch. And so we need to model as a community mask wearing, hand washing, keeping our distance in large crowds, engaging in certain activities. Really model the priority is to keep our school open and safe. And that has to be kind of the lifestyle change, to put that at the top so that we can offer all of our kids a really safe, fun, exciting place to learn for the school year. The first day of school, a few important things that have to do with COVID. There's no before care this day. You are to arrive during your time slot. So for all of the drop off and pickup, it is staggered. As Jackie mentioned, the pre-screening will be done at home. So there's not a temperature check. You can park your car and walk just to the exterior of the school, but we have a lot of families joining us. And so please try to stick within your time zone. If you know you have a kid that takes a good 5 minutes to get out of the car, we gotta get our sweatshirt on. We're a lingering kind of slow moving family. Come to the beginning end of your time slot. If you've got maybe an 8th grader that doesn't want to look you in the eye and maybe will grumble goodbye and get out of the car, you can show up at 8:45. So you calibrate based on your morning routine and how you guys get out of the house. But students will arrive and be directed by our administration to go wash their hands and go into their classrooms. Parents are invited to walk out onto the field. There is going to be a very social distance spread out, kind of fair to collect materials and information on the school programs this year. Masks must be worn at all times. And if you are not comfortable with coming onto the grass area to receive those materials, we will send them home with your child at the end of the day. Here is just a little grid. As I mentioned at the beginning, we will be sending this slide deck out tomorrow with all this information. But if you have reporting symptoms exposure, we have an email that you directly send it to. If you have questions about the protocols or overall questions, of course, it can go to me and Jackie. Questions specifically about curriculum, go to Michelle, and student learning or support questions, go to Leslie. As I mentioned, there'll be a lot more information about the other functions of the school, but we're still very much living in a world where COVID is a lot. It's a lot for this administration. It's a lot for you guys as parents. It's a lot for kids. It's a lot for the school. And so we wanted to really focus on that component so that the next time we're together and we're talking and we're sharing, we can focus on the programs and the exciting things that we have to offer at the school this year. Here is a link to all of our resources of where we are gathering our information, our authoritative guidance, and our COVID protocol handbook. As Jackie mentioned, an email will go out tomorrow with some call to actions. It is that we have to have a signature that you have read the handbook and to sign up for COVID testing upon re-entry back into school. We'll very easily highlight those things in an email. If you have any questions once that email goes out, please do not hesitate to reach back out. And with that, we will take a look at the chat and the Q&As. Okay, so lots of questions about staff being unvaccinated. So what I can share is that we are not 100% vaccinated as a staff. It is very confidential who is and who is not vaccinated, and that is not something that I can share. Between myself, the board of directors, and the Seacrest Schools legal team, we have decided to not require vaccinations while it is under emergency use, while it is not mandated by the San Mateo County Office of Education, while it is not mandated by the state of California, and while it is not mandated by the United States. So if any of those 4 things were to change, a requirement could be put in place. Will unvaccinated students be required to opt into testing if families off? There's no opting in or out of testing. So testing is a requirement, not only for coming back into school, but the weekly testing is a requirement to come to school for all faculty and students. So there isn't an opting in and out on vaccination status. What we are learning, and Jessica and Roxana can speak to this, that there are breakthrough cases with vaccinated individuals. And so the recommendation is to not distinguish the 2 groups in any sort of testing. Could Seacrest require all parents and those who can get vaccinated be vaccinated? At this time, similar to the requirement for our employees, we're not requiring vaccinations for parents. For drop-offs, what do you do if you have siblings with different drop-offs? You have a couple options. JAWS will be back in action, and the before care that starts at 7:45 is open, and it's complimentary to all. So you can drop at your younger child's time. You should, because they need to start school. Or if you want to hold on to your child and get a cup of coffee and then come back, you can do either option. But any older sibling can come with their younger sibling, and there is before care at that time. Can I comment on the possibility of distance learning during a quarantine smoke days worsening community case rates? Yes. So during a quarantine, it's a little bit different based on the age of your child. What we learned a lot about hybrid learning, and we learned a lot about distance learning, and we learned where it was functional, and we learned where it was really not functional. Our primary department, JK through first, will not be on a one-to-one device. We do not believe in our core heart of hearts that is the best way for 4, 5, and 6-year-olds to learn, and the best way to teach them. So if there was a case that a class or a student needed to quarantine, supplemental work would be sent home, but there would not be a Zoom in situation. In the secondary, we're going to handle it a little bit on a case-by-case basis, but the plan is that for any sort of short quarantining, they would also be receiving work. Once students get more into the upper school, if it was a long period of time, multiple days, there's a lot more functionality and independence in 5th through 8th graders to possibly be able to Zoom in with their teacher to check in on their work. They're submitting a lot of work digitally through Google Classroom and things like that. We will not be offering a hybrid option this year. So there is no option to stay home and Zoom in to any sort of live classes. With parent coaches, will we be tested as well? Yes, and the league is still really working on their own requirements. Vaccination status, testing, all of those kinds of things are not only school protocols. The county has not come out with any sport guidelines yet. They're coming out with them on September 15th, I believe. Yes, September 15th. So we're waiting to hear what the guidelines are about athletics. All parents are required to volunteer. All volunteers are required to be vaccinated. Therefore, all parents are required. Therefore, all parents.
I'll just say not all volunteer opportunities are in a classroom. So this is just we're really limiting the vaccinated parents to people that are interacting with students or on campus. There's lots and lots of ways that you can volunteer without stepping foot in the building.
Mm-hmm. Please clarify the situation with symptomatic testing of students. Wouldn't the student be at home?
Yes. So yes, but often people, if we're going to make you COVID test to come back to school, a lot of people would bring their kid to school. We'd COVID test them, then they'd go back home. It's totally your discretion of what it depends how sick your kid is too. But we are going to require a test, and we will provide it here. In any of these cases, you don't need to use our test, but most people find it more convenient just because it saves you a trip over the hill or anything. And all the testing, by the way, this year is free. So there is no cost to the school for any of the testing that we're doing. So, if when in doubt, if you need tests, let us know and we can work with you on it. And then there was a question about the pooled test. So yes, if a class tests positive, if the whole classroom tests positive, then yes, we would need to PCR test, and the students would not come back to school until we know who has COVID.
Any other?
I think a major point of all these questions too is a lot of this is changing, with a lot of the close contacts and things like that. What our guidance is now from both CDC and California and San Mateo, it's all changing so rapidly that, like Lauren said before, it might be different in 2 weeks. This guidance is different now than it was 3 weeks ago. And it really varies based on the case numbers and what we learn about Delta and then any other variants that come up. So it seems a little hectic and crazy to have so many different algorithms, but they keep changing and we keep making sure that we're on top of it. So just keep in mind that we're just trying to keep up with what all the standard guidance is. And like Lauren said, or I think Jackie said earlier, we're not making these algorithms up. This is based off of the best scientific data that is out there and available to keep everybody safe.
Any other questions? Is there any distancing within the classrooms? There is some distancing within classrooms, not all the time. So some students may be working in small groups. They may be called up to a teacher table to read, depending on the age or the group. They will be masked the whole time. The recommendation is 3 feet if you can. But also remember that exposure is 15 minutes. So the teachers will really monitor the amount of time kids are within any sort of close contact with each other within a classroom. So for the bad air quality days and students are told to stay home, will there be remote learning on those days? Like I said, it really depends. It depends on how much notice we have. It's not an easy switch to flip on for us to work on. We focused last summer a large percentage of our teacher training and in-service on creating virtual classrooms and all of the things that we have not this year, because we wanted to focus on curriculum, differentiating instruction, and student learning and assessments. And Michelle and Leslie will be sharing out more of that. We're really optimistic that we will not have to have very many closed school days. As you know, our local schools are all open. They have their own protocols. We have our own protocols. We do not anticipate schools being closed for any reason. If that were to happen, I am positive and very confident that the school would pivot. But for one bad smoke day, we're not going to pivot to an entire virtual school. we're going to consider it like snow days in other parts of the country. So there's no distance learning option. Any other questions? Apologies for the pause. I just want to make sure we get through all. Okay. I really, really appreciate everyone tuning in, hearing about our COVID plan. Please entrust in us. Know that as I mentioned, we will be agile, we will pivot. As both Jessica and Roxana said, we have not exactly lived in this situation, but we learned a lot last year. Seacrest did guide this school through, and all of our students through, an entire year without cases of transmission. We are immensely proud of that, and we really believe that we have laid out a really nice plan that is more conservative while also starting to pivot back towards focusing on what's best for students and student learning. And that is really the goal this year. So thank you so much for joining us. Thank you for your continued support and understanding that it's not as easy of a year as we maybe had hoped in the spring, but we are wildly enthusiastic to have all of your kiddos back here on campus with us and safe. A huge thank you to Roxana and Jessica and our entire health and wellness team that meets with us after their long shifts with COVID patients in the hospital to guide us, provide us insight, and really weigh out how to best operate the school for all. So I really thank everyone for joining us. As always, feel free to directly reach out if you have any questions. Tomorrow, this email will come out with the recording, the slide deck, and those 2 call to action. So please, if you feel like, wow, that was a lot of information, it was, and absolutely, you can kind of comb through it, and we're here to answer any questions you may have. All right, have a wonderful evening, and we will see you in a few days. Bye.